Welcome everyone, my name is Gary Alton and I'm the Managing Partner of the Employee Benefits Division here at the Partners Group. I'll be presenting today. We're going to talk about private exchanges, benefit enrollment options. Probably the word I would start using vernacular is a marketplace. So we'll be going over that. I'll set the stage, do a little bit of introduction about who the Partners Group is. Then I'll turn it over to Sarah Friend, one of our employee benefit consultants, and she's going to do a little bit of a level set because I think there's a lot of verbiage out in the marketplace, there's a lot of words and a lot of confusion. And so she'll help give you kind of an overview of when you hear private exchange, marketplace, those words, what does it really mean? And then I'll come back up and I'll talk a little bit about the strategy that the Partners Group is undertaking and where we're going, where we see the marketplace, and then we'll wrap up, get you out of here at 9 o'clock. If you have questions throughout the presentation, I would ask that you just shout them out and we'll try and address them as best that we can. But with that, I want to address a little bit about change because I think what you're going to see out in the marketplace is there's a lot of change coming. And for those of you in HR, there's been a ton of change. The Affordable Care Act just celebrated its 5th birthday a couple months ago, and I can't believe it's already been 5 years, and things continue to move forward. But what I wanted to do first, just to give you a quick overview of the Partners Group, we are actually 4 different divisions integrated together. I oversee the Employee Benefits Division, and we have about 55 people that work in that division. Sean Higley is in the back of the room, but he's my counterpart. He's the Managing Partner of the Private Client Services. He oversees executive benefits. He works on 401k plans with him and his team. We do have a commercial property and casualty team, and then we also have a business consulting team that does unique projects for larger employers, a lot of population health management, etc. And then when you look at the employee benefits, what we do in our division, we have a little over 500 employers that we work with. And we do the full scope of services, full spectrum. So health and wellness, vendor management and negotiations, communication, legislations, compliance, ongoing customer service, reporting and analytics, all of that is wrapped up into the Employee Benefits Division. What's interesting as I was putting together this presentation and thinking about the technology platforms, these online enrollment systems, every one of those buckets is touched by an online enrollment system. And we're going to talk a little bit more about that as we go through the presentation. So the Partners Group, we're an independent firm. We've been around since 1974. Bruce Kerr founded the Partners Group, Kerr Insurance back in the day. And again, one of the things that we've recently formed is a company by the name of C2. And some of you may be aware of C2. This is actually a partnership between the Partners Group and 5 other large nationally recognized firms. All of these firms are independent. All of these firms want to stay independent. But what it does is when we put our books of business together, it makes us the 5th largest privately held benefit firm in the nation. And really when you think about what that does for us on a national stage, it allows us to leverage pharmacy benefit contracts, stop-loss contracts, life and disability contracts, and actually going to be the latest, and we're going to talk a little bit more about it at the end, our new marketplace that'll be launching 10/1 through C2. And that's another thing that has evolved from our C2 relationship. So the Partners Group, independent firm, but again, a national presence as well. So just a little bit of background about who we are. And so let's talk about change. Let's kind of set the stage a little bit. So I went back. So Apollo 11 landed on the moon. The first Game Boy that came out had more computer programming power than the lunar landing module. So again, a little scary right there. My first voicemail. Okay, anybody else remember these voicemails out there? Okay, a few. Okay, not everybody. Got some people going, what is that? I've never even seen that before. I thought it was pretty cool back in the day. That was my first cell phone right there. Now again, there's people in this room going, that's a cell phone? I can't believe it. Now what I thought was really cool though is when I got the stubby antenna. Okay, again, technology changed. That was a big upgrade for me. Skinny battery on the back and the stubby antenna. But as you think about the world that's changing, think about Netflix. Anybody know it was Reed Hastings who built Netflix? How many people have been to a Blockbuster in the last 5 years? So kind of an interesting world. Things are changing. Technology is changing. Read that for a second. A little scary. Now just to pull one other stat, 4 billion videos are viewed each day on YouTube. Maybe not watched the entire way through, but 4 billion. That's a lot. The world is changing out there. This one's scary. 6 billion people on the planet. 4.8 billion have a cell phone. Only 4.2 have a toothbrush. Okay? Now, I heard this stat, and I went to several different, I found it on the internet, so it's got to be true, right? So, but again, it's a little crazy, but there's multiple sources that confirm this data. Some of them were 4.7 versus 4.1, but again, the world's changing out there quite a bit. Read that. Each day in Twitter, 10 million page book. Think about the information that's out there. Think about everything else that's going on. Now, other changes. This is a newest cast. This is a cast that is custom fit to a person's arm. Again, it is much more comfortable, and actually it's a little bit hard to see, but these actually promote healing. So again, there's cords, electrical stimulation, some pretty amazing medical technology that's coming out. I was actually at a barbecue this weekend with one of my engineering buddies, and he works for a company that does digital 3D printing. And they were talking about printing food. So a little bit crazy with starch and other products, they are actually printing food. So it's pretty amazing. But I think when we think about, okay, all the change and how does that impact our business, just take a look at the changing workforce. And you think about 2010 to 2020, that's only a 10-year span, and we're right there in the middle right now. But look at the percentage of millennials. And again, those are individuals born between 1981, and I had to write it down because I wasn't born during this period of time, 1996. So 55% of the workforce in 2020 are going to be a millennial. And again, you think about your workforce, and what I would tell you is right now, your workforce is very diverse, and it's getting more diverse every day. You don't have just one pocket of people. You're going to be looking at, okay, how do I service, how do I take care of a wide breadth of our employees? And does one plan fit? And we're going to talk about choice and some of the options that are out there. But just an interesting survey, how millennials rank the importance of life's everyday items. Mobile phone, 96%. It was the #1 rated item. Okay? Now, I would have probably put coffee a little bit higher on my list, but you start looking at that, and then you start thinking about what's important to these individuals. If this is going to be my workforce of the future, how do I communicate? How do I serve? How do I recruit? How do I retain? All of that, while we're talking about technology and an online enrollment system, it is a bigger discussion. And talent acquisition, talent management is going to be critical. And that's really what we're here to talk a little bit about today. This is one piece of the puzzle. And so with that, I'm going to turn it over to Sarah. She's going to talk a little bit, like I said, about level set. A big buzzword that's out there is the private exchanges. You're going to hear more and more about it. And so with that, Sarah, I'll let you take over.
Great, thanks.
Thank you.
Good morning. All right, well, my job in this presentation is to just set the stage. And I can't believe that it's been 5 years that we've been talking about the Affordable Care Act. And really before the ACA passed, we didn't talk about exchanges. Exchanges weren't in our vernacular when we talked about benefits. And now it seems like that is the buzzword, that it is so in vogue, this idea or concept of an exchange, that everybody labels whatever it is that they are doing as an exchange, which creates a ton of confusion about ultimately what the heck is an exchange, because I thought this over here was an exchange, but then my boss brought into me an article about this new exchange that Walmart is doing, and shouldn't we be looking at something like this? But that looks completely different from what I thought an exchange really was. So before we talk about our solution here at the Partners Group and what we're going to be presenting to clients, I just thought we would take a few minutes and just talk about, remind ourselves where the concept came from and how it's evolved in our marketplace, and what the big houses nationally, what they are labeling private exchanges, and in reality, what that looks like here in Oregon. So we're going to start with, let's see if I can get this to work as slick as Gary did. just a history. So again, the ACA, when it passed, a key or cornerstone of that legislation were these public exchanges or public marketplaces, really for individuals. It became, the online source where individuals were going to be able to shop and compare insurance and in a guarantee issue environment. The public exchanges also were the point where individuals would apply for and receive federal subsidies to buy those individual health insurance policies. It was really marketed as the Travelocity of insurance. And isn't it going to be great? We're going to be able to go on a website and you're going to type in a little bit of information about yourself, and just like Travelocity, you're going to have your 6 options pop up, and it's going to do, narrow the field for you, and you're going to have just this wonderful shopping experience. Well, does anyone remember Cover Oregon? That type of software and that type of technology is easier said than done. Even healthcare.gov really struggled in that first year of implementation of this large public exchange or public marketplace. Now, healthcare.gov has come a long ways, and we in Oregon, we know we've closed the book on Cover Oregon and have shifted ourselves to healthcare.gov, and it has become a lot easier, but I would not say that it has achieved the mark yet of that easy Travelocity experience. Healthcare is pretty complex, and we've got a long ways to go before we get to that experience. So that's where the term exchanges started. It really started in that new individual world created by the ACA. So that promise of easy shopping, great comparison, lots of options, really promoted this idea of choice within the small group market. And so in the individual exchange then expanded into the small group market. So the small group market exchange, or otherwise known as the SHOP, this is also a part of ACA, or the Affordable Care Act, that basically said, okay, small groups, so groups with fewer than 50 employees, wouldn't it be great if we could offer to small employers an opportunity where they could say they're going to set a defined contribution for their employees. Let's say you say, my budget's $400 an employee, but I, as an employer, want to be taken out of the driver's seat of trying to decide what carrier is best for all my employees, what plan design is best for all of my employees. I've got employees with various needs, and their families have various needs. So this idea of being able to say, I'm stepping out of the role of having to be the one to make the single decision for my employees, and instead just defining a contribution and giving employees an opportunity to choose between multiple carriers, multiple plan options. Now, if you were at our symposium probably 3 years ago, this is when Cover Oregon had not yet faced its fate, right? And so they were talking about the SHOP and how the SHOP in Oregon was going to deliver just that. Choice, right? You could choose a single carrier, you could choose multiple carriers, you could buy up, buy down tiers, and it looked like it was going to be a beautiful thing. Again, technology is not that easy. And so in Oregon, we still don't have an exchange or a SHOP exchange for small employers. And to be honest, in many states across the country, the SHOP exchange has not yet been rolled out. There is a SHOP exchange available in Washington. All of the SHOP exchanges that have rolled out are rolled out on a state-based system. There is no federal SHOP. And so Washington has one. In 2015, any state that has a SHOP exchange is available to employers up to 50 employees, and then in 2016, it'll be expanded up to 100 lives. But that was, I think, a really interesting proposition for small employers, because today, small employers can't just go to Regents and Kaiser and Providence and say, I want to offer all of you, right? That's not an option in the small group market. You choose a single carrier generally, and you may be able to offer multiple plans within that single carrier, but a multi-carrier offering is just not something that's available in today's market. So that one other thing about the shop exchange is, just like on the individual exchange where federal subsidies are delivered to individuals, the shop exchange, which is also a part of ACA, is the marketplace that small employers, in order to qualify for that tax credit that it's pretty hard to qualify for. But if you do qualify for it as a small employer, the only way you can get that tax credit now is through the shop. So with all of this buzz in the marketplace about the new federal individual exchange or marketplace and the new shop exchange, there was a lot of talk about choice for employees, employers being able to step out of that chair of being the decision maker and move from a defined benefit to a defined contribution model. And so large employers really like this concept, but were not involved in any of the conversations because the shop exchange, which was the only group exchange at the time, was limited to small employers. So all of a sudden, right, market need, right, market response. So the market response was these private exchanges. And so the idea of private exchanges was, well, if the government can do it, we should do this and fill this gap for larger employers. So private exchanges began emerging as a way of kind of duplicating this model for larger employers and for small employers outside of the ACA or federal and state model. Now, any private exchanges, there is no federal money in private exchanges. So that's a key difference between a public exchange and a private exchange. There's no availability of individual federal subsidies on private exchanges, and there's no opportunity for federal tax credits through private exchanges. So let's talk about, again, just defining what I would say really meets the true definition of a private exchange. A private exchange or marketplace is really an online marketplace where employees could go online, learn about, compare plan designs, options, and have be supported through decision support tools to allow them in a group environment to choose between group products purchased for them by their employer. A private exchange is typically fully insured. And so for large employers who are self-funded, that's in a true private exchange, it's a big shift away from a self-funded model into a fully insured program where several employers are joining together in like a group purchasing pool with multiple carriers. So if you think about a true private exchange, there's not very many of them available, and really none in Oregon. And that is because in a private exchange, carriers are agreeing to compete within an employer for enrollment one member at a time, right? And that is so different from how carriers typically work with a group. In today's model, as you all, I think most of you are larger organizations. So when we work to get a bid from a United Healthcare or MODA or Regents, right, we're taking them a census of your population that gives them the demographics of your group. We generally will bring them claims experience so they can predict how much that same group of individuals is going to cost in the future with some, reasonableness. In the new model, you're giving them a census, but of the 100 employees that you're presenting to them, how many are they going to get? 5, 2, 90, right? And they're setting their rates ahead of time. That is a very scary proposition for underwriters who like to know exactly what they're getting ahead of time. And so getting carriers to say, yes, right, I'm in. That sounds great, right? In Oregon, our carriers have just kind of, said, until the marketplace, until somebody, a couple other carriers say yes and we start losing membership, we're on this side of the line, right? And so when you think about these multi-carrier, private exchanges, and you hear a lot about them because big companies have started to use them. Big companies, 5,000 plus employees. So examples of companies that have gone to this fully insured multi-carrier private exchange model are generally these big companies with relatively low paid employees. So for example, Walgreens, another example, Applebee's, IHOP. The seasonal and part-time employees at Target have moved into this type of approach. It's not, so you're going to hear a lot about it because these big companies are talking about it, but they're for very specific reasons. And we'll talk about what those reasons are and how you can take advantage of some of the key things that the values that these private exchanges bring to your own organization without having to wait for this type of solution. So these exchanges are generally managed by a third party. So it's no longer a direct relationship between the employer and an insurance company. Generally, it's a new triangle relationship where there's this third party in the middle. That third party could be a carrier if it's a single carrier exchange, but more likely it's a broker or a technology platform. That entity in the middle who's managing the exchange is the one who's deciding what plan designs am I going to offer, what deductibles, what copays, what carriers. They do all the negotiation, and the purchaser or the employer in these private exchanges is simply kind of receiving the news, right? That, okay, here's our exchange rates, Moda increased their rates by 10%, United Healthcare increased their rates by 20%, et cetera. The employer is simply deciding how much am I going to subsidize my employees, how much of the rate am I going to pay versus how much of the balance is going to be passed on to my employees. So here's just a visual of that new relationship in a true private exchange. So again, the relationship is between the employer and the private exchange, and the private exchange is the one who is then delivering the technology platform to the employer and has the shopping experience with your employees. They're interacting with that private exchange in an online marketplace, and the private exchange then is the one doing all the billing premium for the employer and the reconciliation, the enrollment, and then the private exchange is the one who then transmits that information to the carrier. So just an idea about what the true kind of private market exchange looks like at this point. So this graph, this is from the Kaiser Family Foundation that last year did a pretty good comprehensive report on private exchanges across the country. It's on the web, so Kaiser Family Foundation Private Exchanges. It's actually a pretty interesting read. On the left, you can see if it's too small of a print. On the far left, that 12%, that dark blue bar, that represents the number of firms with between 200 and 999 workers who are considering the idea of a private exchange in the future. You can see that as you move to the right, so the next kind of royal blue 18%, 18% of firms between 1,000 and 5,000 employees are considering an exchange in the future, and 20% of firms 5,000 or more are considering private exchanges. So you can see that as an employer gets bigger and their benefits needs are more complicated and you're delivering to a mass audience, that the idea of this private exchange marketplace becomes more attractive to these organizations. On the right, aside from a private exchange, this is the kind of appetite, for firms who are considering a defined contribution model. So lots of employers, instead of saying, I'm going to pay a percentage of premium moving forward, are instead saying, I have so many dollars that I can spend on benefits. And that's all I can spend. And so you don't have to move fully to a private exchange model to adopt a defined contribution model. So you can see that while only 12% of firms between 200 and 1,000 lives are considering a private exchange, almost 25% are considering a defined contribution model of some sort. And that's pretty, most firms are about in that same area of appetite for defined contribution, versus you can see it's pretty different based on group size in terms of adopting a private exchange. This slide tells us, okay, well, if that's the appetite for future consideration of exchange, this slide actually shows us the percentage of firms that are currently offering a private exchange to active workers by group size. So on the far left, you can see again in that 200 to 1,000 life category, which is the category that I focus on here in Oregon because we are a smaller group state. We don't have that many employers who have more than 1,000 employees here. Only 2% of employers in that market have a true multi-carrier, fully insured private exchange. So private exchanges are not the end-all be-all. They are not a great solution for everyone. One, it means you're moving away from, if you're a self-funded employer today, it means you're likely going to have to move away from that if you want to go to a true private exchange. And so employers lose some of the freedom and control over your own plan options. So we are stepping out of the driver's seat generally and accepting what that third party is delivering to employees in terms of plan design options, deductible options, etc. If you, as an employer, believe that you have better than average utilization, you're going to be in a pool that's subsidizing others, and that's generally kind of goes against the grain of employers who have chosen to be self-funded for a purpose. Some of the value of being self-funded is that we know that your fixed costs are lower in a self-funded environment in terms of lower taxes, lower administrative fees, and of course reduced carrier margin. So in Oregon, if we don't have, we see all the buzzwords, right? We see all this press about private exchanges nationally, but in Oregon, if that's not a solution, then how can we in Oregon take advantage of some of the great things that a private exchange offers to employees and create that same choice, shopping experience, decision support tools for your members without having to wait or rely on our carriers to decide, yes, we want to participate in a true private exchange. So many employers want those benefits. They want to add more choice. They want to add multiple, plan options to their employees without the complex administrative burden of having to be there sitting shoulder to shoulder with an employee and describing the differences between why they should choose the $200 deductible over the $1,000 HSA option. I mean, that level of choice and what is required of your HR team in terms of supporting your employees, you really do need some sort of technology platform that's going to help educate your members without you sitting one-on-one with them, support them through that process. And some of the tools that Gary's going to talk about are pretty robust in terms of their capabilities around member support. So an exchange-like marketplace. So we're going to transition from the word exchange. When I use the word exchange, I'm talking about that multi-carrier, fully insured marketplace, or fully insured exchange, that we hear about at the national level. But what Gary's going to talk about is more of an online marketplace that, again, can be single employer. You're not joining a pool, right? You can customize the plan options that you want to deliver to your employees. It's likely going to be one or two carriers here in Oregon because our carriers here in Oregon are used to doing a split with Kaiser. If you start introducing anybody beyond Kaiser to the party, carriers start to get nervous. But you can do that through technology. So it also will, again, provide improved member decision support tools, improved efficiency for onboarding of new employees and annual open enrollment. There, just a caution here, we all want reduced cost, right? I mean, that's what we would all love to achieve. Beware of brokers or people who come to you and say, if the exchange is going to reduce your costs, because as you know, our costs are driven by utilization and the cost of services, right? There's nothing really in a marketplace environment. It's about delivering additional choice to employees. It doesn't attack the root cause of our increase in costs. It may promote more consumerism, but you'll see in my next slide that that actually may have an adverse impact on your overall costs, because most of your employees aren't using much health care, right? Most employees use $1,000 or less of health care. So if you don't carefully consider the options you're giving to your employees, they're going to buy significantly less health care than they're probably getting today, which means adverse selection in your pool. The whole idea of insurance is that you get a lot of healthy people together, right? And we all together pay for the needs of the few. We may be the few next year. We don't know, right? But if we only buy the insurance we're actually going to use, right, that whole pillar of the cost model is kind of deconstructed. Okay, so be careful when you're doing that, and be cautious of bold claims of reduced costs. Okay, so adverse selection, we just talked about that, and that is, okay, so if there's no private exchanges here in Oregon to choose from, but I really like the idea of enhanced employee choice, great technology, then just be careful and work with an advisor so that you put the right menu of plan designs together, so that you don't end up creating what we lovingly refer to as a death spiral of your health plan, because there is. So this is again the findings from the Kaiser Family Foundation. So this is showing you what employees actually do as a result of choice. So on the left-hand side, this is the year one on an exchange. So it shows that percentage of employers or employees, individuals who choose similar coverage, which is the darker gray on the bottom. So Aon and Bloom are two of the national fully insured multi-carrier exchanges. So in Aon's model, 32% chose similar coverage the first year out there on the exchange. 26% chose more coverage, and 42% chose less coverage. In Bloom's example, 66% of the employees chose less coverage. On the face of it, that's not a bad thing. I mean, employees are being empowered to use the dollars the best way that they can for their own employees, but you have to balance that with the overall funding needs of the plan so that the plan doesn't end up blowing up. Okay, with that, I'm going to turn it back over to Gary.
So I know there was a lot up there. I think it's important to understand the difference between a private exchange and a marketplace. And we kind of see this buzz out there that, think about private exchanges and that whole concept, defined contribution. And defined contribution's been around since 1979, so it's not something new that's out there. But we kind of look at the private exchange, and that whole conversation is the town you're going through to get to the big city. And we do believe that that big city is the marketplace. So a couple other things that off of Sarah's that I wanted to make notes of. Number one, the concept of choice. And she got into this where, to me though, choice equals complexity. So if how many HR people out there right now think that more than 50% of your employees could tell you what their deductible and their coinsurance is on their health plan? And so I see some smiles out there. And then you think about it now, let's say, and you might only have one or two choices to them. What if you gave them 5 or 6? How do you communicate that? How do you track it? But that's what we're starting to talk a little bit about. Another thing that I would just get into, Sarah said it at the end, is that adverse selection though. And just a real simple example, if you offer two plans and one's a $250 deductible plan, the other one is an HSA plan with a $2,500 deductible, which plan are the healthy people going to choose? HSA plan, right? Unhealthy people probably going to take the $250 deductible. So what happens in the overall funding? Your overall funding of your health plan just went down substantially, but the overall claims probably stayed the same. So that goes back to what Sarah was talking about, kind of that death spiral. So just putting an exchange or a marketplace out there and giving your people 10 different options probably it's not the smartest strategy out there. Number one, how are they going to even comprehend it? But number two, you have to be real careful about your plan stability. Where are you going to be 3 to 5 years from now? What I will tell you is if you're under 100 lives, you will be community rated. So there's a little bit more flexibility out there, but over 100 lives, your experience and how you use the plan and how your members use the plan drives future renewals. So you do have to be really careful about designing it on the adverse selection. A couple other things that Sarah hit on a little bit. If someone tells you that putting in an exchange or a platform is simple and seamless, they might be lying to you or lying to themselves, because it is tough, it is complicated. We're going to talk at the end a little bit about implementation, but that's another thing that you need to take into account when you're contemplating this. What is my capacity? What is the capacity of my employees, the members on the plan? So real critical there. She made a great point about insured versus self-funded. And we do see, the exchange is more of a insured product or vehicle. But again, as you get to a marketplace, you can have a self-funded plan. And we're actually seeing more and more employers considering self-funded plans, even down to 51 lives, with some of the new regs and changes that are going to be coming out with the Affordable Care Act in January of 2016, as well as it typically saves, when you go self-funded, somewhere between 6 and 10% just off the total cost of the plan. And then you get into some of the details about understanding what's driving healthcare. So I think those are the key things. The last bullet point that Sarah mentioned is that while these marketplaces, we do believe that from a retention, offering benefits, it's going to be critical, choice is going to be critical, and it will help you manage and be more efficient. 85% of a healthcare dollar is spent on claims. So while there's all this buzz and everything else going on, you can't lose sight of the health of your population. And I think that's really critical to keep in mind. So with that, we're going to talk a little bit about TPG's response or our strategy as we go forward. And what we see out there in the marketplace is there's kind of two extremes right now. Some consulting firms have gone all in with a single platform and saying that's where we're committed, and I don't care if you are a square peg, I'm going to put you in a round hole and you're going to fit. There's other consulting firms that have gone out and said we are agnostic, that we'll work with anyone. What we've done is we've really kind of come in between, and you're going to see that a little bit where we will partner, work with you, define what's best, because no one employer is the same, but at the same time we have negotiated and developed national offerings that can drive value and benefits to our people as well. So we want to talk a little bit about that. Anybody guess what this is a picture of? Yeah, so this is an Amazon distribution center. So again, just another little technology concept, but it's not all technology. There are some people in that picture there. But again, most of you have probably bought something on Amazon. I thought it was a great picture. It's another great example of how technology has changed our lives quite a bit with the shopping experience. So here is our strategy, and I want to take a couple minutes to walk through this. At the bottom of the platform, as I said, we can help consult because no one employer is the same. There's over 250 different platforms, whether on a standalone basis offered by a carrier or just an ancillary line like a life and a DI carrier as well. So there are a lot of options out there, and I can tell you there's more and more popping up every day. When I look at the marketplace, there's some exceptional systems out there, some very good systems, and then I would also tell you that there's some systems that look very good, but when you get underneath the hood, they're not all that great. So you do have to be real careful when you're vetting what is the best system for us. When we look at it, we look at a lot of different aspects, experience of the member, how it looks, how it flows, the setup, all of that. But we also look at how many clients do they have right now? Who are they doing it with right now? Do they have 5 clients or do they have 8,000 plus clients? What verticals are they in? Another big piece is that we look at what's the ownership of these companies. how deep are their pockets? Because any of you that dealt with technology, I know we have several medical clinics in the room here, and just think about how many thousands of dollars you've spent, or hundreds of thousands of dollars you spent on your electronic medical records from a technology standpoint. And it's not just you pay once and then everything's set. There's ongoing costs, there's reinvestment. You need to have a platform that has very deep resources as well. But again, we can work with any of these platforms. We can help you ferret out the good from the bad. And then I think it's also important to talk about implementation. Because again, it's not that hard, but it does take time, it does take effort, it does take a project plan. If you just go in and think, well, we're going to have a couple 1-hour meetings and we'll be set up and ready to run, again, I would change your expectations a little bit. At the next level, this is where we start to come in and say, okay, this is the hybrid. So we are working, TPG has negotiated a proprietary offering through PlanSource, one of the strongest platforms out there. Again, very deep resources. And again, that's going to allow us to go to any carrier, look at any options. Again, this is something that Sarah talked about, those big private exchanges. You don't get a lot of flexibility. But again, with the PlanSource platform that we've negotiated, whether it's a Moda, a LifeWise, a Providence, a Regents, we can plug in those options. And then on the other side, we are having discussions with preferred carriers as well. So there's payroll systems that are out there. GNSA has a good system, ADP, PrimePay. There's a lot of different options that are out there. And sometimes that is the best solution to take your payroll vendor and HRIS vendor and plug on a module there as well. So again, we can work through that. You still need help in getting the plan set up, getting the eligibility, all of that. But that's at the level where we are negotiating or having relationships with these different entities to deliver value to our clients. The next level up, and I'll tell you, this is probably more for self-funded plans, but we through C2 and the Partners Group do have a private marketplace that is going to be rolled out 10/1. And again, the difference here, as you get larger, as you get into the self-funded environment, you get claims data. One of the other key aspects of these online enrollment systems, when you have choice. So now we do have 4 or 5 plans that we've designed so we can minimize adverse selection. How do we help people choose the right plan? And that's called decision support. And there's a lot of tools out there right now that you can plug in to say, I'm this age and I saw the doctor this many times. But again, that's at a very surface level. We have developed through Optum the ability to actually get claims data. And that claims data, whether it's pharmacy or medical, from the health plan, can go into the algorithms and actually recommend a plan design for that individual or that family. And so again, this is really the next level as far as decision support. And you start to think about the options that we need to offer and the understanding of the consumer out there. This is going to be critical in driving the decision support. So again, the claims data, actual last 12 or 24 months of claims data can help drive a person's choice, and it can put together a plan. So I wanted to share that with you. And again, at the top of the pyramid, I've already mentioned it, but again, we cannot lose sight. Technology is great, it's fun, you can put videos in, you can communicate, you can do a lot of different things that we'll talk about in a couple minutes. You cannot lose sight of the healthier population. And again, 85% of claims drives your healthcare spend. The other thing that I would tell you, we're just talking about health insurance right now and the premiums. There's so many other ripple effects. If you have someone that is sick, they're out, so they're taking PTO, they might be doing short-term disability, leave, all those different pieces. The cost of someone being out long-term is substantial. It's more than what you're paying just in health insurance. So again, you need to keep that in mind, that we can't lose sight of health improvement. So here is just a menu when you talk about what can the employee do on a system. So obviously you can shop. And I think one of the things that I mentioned up front, retention and recruitment is going to be critical. So as you start to offer more voluntary benefits, again, it doesn't all have to be employer paid, but again, people are looking to customize the plan to meet their needs, their family needs. So do you start offering a couple different dental plans? Are you offering voluntary critical illness, accident, additional life insurance? Don't laugh, we're getting more and more requests every day for pet insurance. Okay, so this is one of those things that is out there that some of you may say that doesn't make a lot of sense, but again, think about the diverse population. If pet insurance wasn't critical or wasn't important to someone, it wouldn't exist. So again, it is out there, it's changing. There's gap policies that are coming out that for people that have higher deductibles, it can fill the gaps. Because if someone has a $6,000 max out of pocket and something bad happens, that's a big check for them to write. So there's a lot of new gap plans that are coming out on the marketplace as well. A lot of educational content. Sarah mentioned education, awareness, consumerism. This is something that I believe is going to get better and better as people start to understand more about healthcare, understanding, who is a good provider, what is an outcome, what is the cost of these services. It again is expanding. So you can educate a lot. We've talked about personal plan recommendations. Sarah talked about defined contribution, where again, you can either have a traditional model and say, we're going to pay 90 or 100% of the employee only, we're going to make this contribution to a family member, or you can do a defined contribution. Everybody gets $450 a month, and again, shop to your heart's desire. So again, the systems will support both. Again, employee communications. This can actually be something year-round. A lot of times we think about these systems that it's just an open enrollment and all the paperwork and all the selection that we have to make, but this is actually something that is evolving into we can communicate to employees year-round through this system, and again, that can be either driven from a carrier partnership or from the employer, and that's what we see a lot from the employer. The benefit enrollment, obviously, but people have life event changes. Again, it can track life event changes. Someone gets married, gets divorced, has a kid, they can go onto the system and they can add or drop a dependent. And again, all of this needs to be verified by the employer. Mobile apps, again, it's standard operating procedure. Every platform out there that you're looking at needs to have mobile app technology. I'll go back to millennials, 2020, 55% of your workforce, what was their number one item? Cell phone. So again, critical. I was just curious as I was practicing last night, is there anybody in the room that doesn't own a cell phone? I was going to be impressed if someone did, but or maybe they don't want to raise their hand, but I'd be surprised. You're one of the 4.8 billion out there. Spanish support, and then the other thing that you will see this evolve and continue to evolve, but a lot of wellness programs and incentives that can help you manage and track these wellness programs as well. And this is just a picture of a mobile app, but I mean, benefits at a touch, all the different benefits, medical, dental, vision, prescription drug, voluntary, ID cards will be there. And now again, you can get those from the carrier, but you'll have it for all of them. Everything there, you can even get messaging on your cell phone as well. So technology is great. The next picture I wanted to show you, and I know this is a little bit busy, but I like to sometimes visualize things a little bit. So this is actually the Optum C2 marketplace that we're going to be rolling out at the end of the year. And in the middle there, that is the marketplace. That's where people are going to be making decisions, enrolling in medical, dental, life, disability, the voluntary programs. And on the left-hand side, you can see, okay, from the HR team or the HRIS system, you're loading eligibility into the system. We need to get the people's information in there, so again, we know when they type in their password and they pull up their screen, it's their information. So that's the employer responsibility, getting that information in. Then once selections have been made, they can send a report to your payroll system, and that's for all the withholdings and all the deductions. So that's kind of a traditional benefit platform. And actually, if you think about that second line down on the right-hand side, the 834 enrollment files, that's what the marketplace will send out to all the different carriers. So again, someone signs up for medical for themselves and their spouse, it will send to that carrier, that TPA, electronically, that enrollment data. And again, that's an open enrollment and also online. Again, where the C2 marketplace differs a little bit is up at the top, you can see that we're getting historical claims data going into the system to help with that decision support. And at the bottom, if you do have a custom network or a formulary that's unique, you can actually bring that into the system as well. So if people are saying, is this drug covered under my plan? They don't have to go to another website. They can type it in right there on the platform and find out, is that drug covered, or is it a tier 2 or a tier 3? So again, we can plug that information in. And then out of all that data, there's actually health engagement opportunities that can be sent. So again, this is getting into a proactive modeling to say, who are our high-risk members? Let's identify those because we're getting the claims data in, we're doing the scrub, and then we can send that out back to the TPA or the carrier. It may be appropriate for disease management, chronic care management, a lot of different opportunities out there because we can't lose sight of healthcare. But I just wanted to, sometimes I like the visual to show you the basics as far as the flow and then some of the unique things that the Optum Marketplace through C2 is going to deliver as well. The other thing though that you can't forget is the member experience up front. If you roll one of these plans out, again, this is going to be new. Now the millennials may love it, and there's a lot of people that are technically, very savvy, but then there's also a lot of people that like paper. I'm one of those people that still likes paper. So, again, the communication is going to be critical. So multiple communications, multiple vehicles, whether it's paper or electronic, you need to do some prep, some communication beforehand. If you just roll out an online enrollment platform and you say, hey, everybody go to this website and enroll in benefits this year, you're going to have struggles. So again, communication up front is going to be critical. The member experience, and I know this is a little bit hard. We toyed with doing an actual demo, but then we start looking at, okay, who are the people registering? We got groups of all different sizes, insured and self-funded. Really hard to do a full-on demo. But again, you can see on the left-hand side, this is an individual. They can go through and select their medical. If they do an HSA, they can put money into their HSA account. Life insurance, what they're signing up for. What are the costs, whether it's employer-funded or employee-funded. Again, so it's a visual about, okay, yeah, I may be paying $100 a month, but my employer is paying $600 a month for my benefits package. So some great messaging there. Over on this side, just to show you a little bit, this is actually, an employee's profile. So this would actually be the landing page. Right here it talks about medical preference. So, help me find a plan. Healthcare use, so this is the actual data coming in. Or people can just type in, I'm seeing these providers. So again, making sure that those providers are in network. Or I'm taking these certain prescription drugs. I want to make sure I'm getting on the right plan based on my prescription drugs. So there's a lot of different ways that employees and family members can go online and help to be supported in their decision. But wanted to give you a little bit of a view of that. And then also employer reporting. Now, I don't expect you to read these, but this can help you manage the open enrollment process. So this one here is just showing you what employees have enrolled and who still needs to enroll. So now you can send out to say, okay, we still have 20 people that hasn't enrolled. Open enrollment closes in 3 days. I'm going to send out an email message just to those 20 people and remind them they have 3 days to get their paperwork in to go online. You can see, what plan, if you're offering multiple plans, who signed up for this medical plan, this dental plan. Again, you have that flexibility. Some larger employers may want to employ a call center to help them field the questions when people are going through. So we have call center capabilities that will be able to support employees and their family members through the enrollment process. If you're a larger employer, you may not be staffed up to take a lot of questions, especially if you're offering new benefits. So again, there's call center options as well. And then you also have the ability, one of the things that a lot of the systems, it's open enrollment and then it's a new hire and they go online. A lot of these systems are developing to where they're actually a central focus place for a lot of the benefit things that you're doing. You can drive wellness plans, you can drive content, you can drive education. We have some groups that are actually using it for other education processes, so they're driving videos to it and it's actually part of their training process. And people need to go watch the video and then take a little quiz, and basically it certifies, I saw the video, and oh, by the way, the system knows that they've been on for the full time, watched all the slides, and then they take the quiz. So there's other applications to this as well, and you can see a summary of, okay, how many people went on, what buttons did they hit, what was the hot topics, where did they go, are they having questions about formulary, network, all those different things, so you can see how people are using the system. So, as we wrap up, and we're a little bit ahead of schedule, but we will leave a little bit of time, some of the other things that as we were sitting around putting this together, what might be some of your other costs? So again, our goal today was to give you a little bit of background, define what a private exchange is, and then have the conversation about moving over to the marketplace and having you think about retention, recruitment, your changing workforce. Wanted to give you a sample of what's available out there. Again, there's a lot of great systems and there's a lot of systems that look really good. Helping you choose what is the best fit is a critical decision, because this is not a decision that you want to do over. So again, once you go down the path, you want to feel real comfortable. But a couple things that you should be considering. What are my members' needs? Whether it's my employees or the family members, what are their needs? Does a system add value to my company? There are going to be some groups out there, you might be a single site, low turnover, from a culture standpoint, they like the paper. It may not be the right fit for you. So again, this just while it sounds great, it may not be the right fit. Again, you got to sit down, talk about your needs, look at all those different issues. Now, systems costs. I know this is something you're probably all wondering about. Okay, what does it cost? We've seen plans, programs anywhere from free, and free sounds very good, but sometimes you get what you pay for, all the way up to, typically a system's going to be somewhere between $4 and $6. One of the unique things that's out there, though, is we are seeing a lot of the carriers in the marketplace, especially the life and disability and the voluntary, say that if you can have an independent platform, plan source, but if you put in our program, so if you put in the life and disability through Standard of Oregon, for example, or voluntary programs through the Guardian, those platforms, they will subsidize the fee. So just to give you an example, in Montana, we're putting in, it's about an 1,100 life group. They've selected Plan Source, so went through the due diligence. They selected Plan Source, and they're putting that in, and because of the different lines of business that they're putting, and actually they have Standard for their base plan, and then Guardian for voluntary. Unum's another carrier that does a lot of this as well. Their online enrollment fee is $1.50 PEPM, so per employee per month. And then they elected to add the Affordable Care Act, the tracking, and the 1094 and 1095, all of that, so that it'll produce it. So they selected both of those, and it's another $1.50. So for $3 a month, they're getting a very robust system. This is a school district with multiple locations, people spread out all over the place. So really looking to simplify their admin. But just to give you a feel, but again, it's all over the board. There's a lot of different options out there, and we can help you through that. The next one is implementation timeline. Again, anybody that tells you it's simple and seamless, that might be a little bit of a red flag. Or they say we can get you set up in a week or 2 weeks. That's definitely a red flag. Usually if you want a full-on, fully set up system, you're looking at a minimum of 8 weeks. Probably is a safer call to look at 12 weeks. And again, setting up the website is really not that complicated, putting in the plan designs and the benefits. The big issue is on the back end with the electronic data interface feeds, or the EDI feeds. Because again, you're going to get that to pay, you're going to have output to payroll. You may, if you have an HRIS system, you're going to get that data feed coming in. And then working with all the different carriers, your medical, your dental, your life, your disability, the voluntary. All those different carriers, you need to have those electronic data interfaces set up and tested. And so again, that is not something that just happens overnight. So it does take planning, it does take work. You just have to be really going in with your eyes wide open as far as what it takes to set this up. It's doable, it doesn't happen overnight, and I think that's real important for you to consider as you're thinking about rolling this out. We've actually talked to a lot of groups about doing this, but they're looking at doing it off renewal. So if you think about it, I know a lot of groups have a January 1st renewal. Might not be the best time to try and implement an online enrollment program as well. So think about it from a strategic standpoint that we've even had some groups that said, okay, we'll set up the website, we'll get the enrollment, but we'll deal with the electronic data interfaces in January, February, and March. So these systems do have the capability, if you don't have the EDI feeds, that they can kick out into an Excel format or other electronic formats that you can still send to the carriers and the vendors. It's just sometimes not as clean. You want to have that EDI, but again, depending on your needs, there's different strategies. You can do a post EDI interface. Again, there's a lot of different options. And then, the last question, just ongoing maintenance, what does it take to keep up? And that's pretty limited. Once you have the system in, once you have your eligibility first of the month following 60 days, this is the plan. Once you have the electronic data interface built, there's not a lot of ongoing maintenance. Obviously at open enrollment, annual, you're going through the renewal, if rates change or plan designs tweak, there's going to be some changes, and we support that from a implementation and changing the website. But really it's more the employer's call. How much do I want to use the system? Are there other strategies that I want to push out? Are we doing an education campaign? Are we doing a preventative wellness? It's February, it's Healthy Heart Month. Do we want to push some information out along our wellness program? So it's really from an employer standpoint, the updates are really limited to how you use the system. But again, a lot of things to consider. A lot of great systems out there. we do believe in the next 3 to 5 years, most employers of any size, even down into the 40 and 50 life range, depending on their locations and where they're at, will probably have some type of enrollment system. The marketplace continues to evolve. A lot of payroll vendors are doing a great job putting these systems together. But again, there's a lot of carriers out there as well. Sarah mentioned a lot of carriers. I think one of the advantages that we look at, and the carrier systems are not bad systems, but what happens if 2 years from now you want to change carriers? Okay, now you got to change systems. So that's why I think having an independent system, whether it's through a payroll vendor or through a plan source or a C2 or another standalone, makes a lot of sense because it gives you a lot more flexibility out there. But again, that's another consideration that you have to go through. All right, good. With that, again, really appreciate your time. So we're out a couple minutes early. The Partners Group team is here that if you do have any questions, feel free to ask. And with that, I appreciate all your time. Have a great day. Thank you.